I'll be part of a multidisciplinary group talking about managing the suicidal multiple sclerosis patient in clinic. The reason that we're talking about this is, as you've heard from others here at the meeting, depression is very prevalent in patients with multiple sclerosis. And one of the things that we don't talk very much about when we talk about depression is risk for suicide. What we know about depression and MS is that it's much more common in people with MS than it is in the general population. So much so that some studies estimate that 1 in every 2 people with multiple sclerosis have major depression at some point in their life after their diagnosis. And what may be surprising to hear is that almost 1/3 of patients admit suicidal intent or suicidal thoughts at some point in their life with multiple sclerosis. So this is a very common but not very talked about problem. And that's what my group hopes to highlight is what is the risk for suicide? How do you identify those patients who are at risk? And what do you do as a neurologist or as a physical therapist or occupational therapist or psychologist? What do you do to manage those patients that you think are at risk? Depression screens are very helpful in identifying patients who are possibly depressed, and many depression screens include a question that asks about thoughts of suicide. So those depression screens are somewhat helpful if the practice is set up that way. But there are also other clues that patients can give you in your interaction with them. For example, a patient changing the way that they dress, no longer taking care of themselves, or showing up late for appointments, or missing appointments, or now talking to you about increasing alcohol use. These are some clues that patients can give us that let us know that their mood is worsening, and it might be time to start asking them more detailed questions about how bad their mood is and how worried you should be. Some other red flags are patients telling you that they feel like they're becoming a burden on their family members or their caregivers. People who are increasingly socially isolated are at higher risk for suicide, for depression and suicide, than patients who have a robust support network. So these are all things that a clinician could be looking for as signs that your patient may be at risk.